Dr. Jonathon Ouellette is a second-generation dentist that loves to serve his community. He graduated from Pontificia University, Javierna, in Bogota, Colombia, and while there, donated time to local villages and orphanages. He then completed a 2-year residency at the University of Florida School of Dentistry, focusing on dental implants. Dr. Ouellette was invited to become the chief resident in Birmingham, and during his time in Alabama, he became skilled in implant dentistry and prosthodontics. He spent 3 additional years as a resident, honing his skills and providing dentistry to those in need. With a family heritage of dentistry, Dr. Jonathon Ouellette is dedicated to creating beautiful smiles in the Altamont Springs area. Dr. Ouellette combines passion of dentistry with the latest in technology to offer patients outstanding dental care.
I was down, but now I'm up. Yeah, it's all God.
We are at the office of Dream Dental Services today in Altamont Springs, Florida, with Dr. Jonathon Ouellette. Welcome to the EG Dominates Dental Podcast.
Thanks, Eric. Glad to be here.
Hey, this is a really cool episode for me, just because I've known you for almost 10 years, and we've worked together off and on over those years. And you have a beautiful practice. You've got an amazing story to tell. So I'm excited for people to get to learn a little bit more about you as a person, as a dentist, as a business owner. So let's dive into it.
What do you want me to tell you?
So let's start off. Talk about where you're from. Where did you grow up?
I was born in Atlanta.
Okay.
When I was 4 years old or something like that, we moved down to Brevard County. So I really consider myself a Floridian. So I've been here, the majority of my life I've lived here. So it was always the plan kind of to be here. It's always been on like a vision board and wanting to do something back in Florida, even though I do have that tie back to Atlanta as well. So, but yeah, Brevard County, in my 20s, I was living in Orlando and really enjoyed that. I got an engineering degree, as a matter of fact, from Full Sail.
Wow. Okay.
And did that for a year or two and then kind of fell into, all right, I really do want to go into dentistry.
So why did you decide dentistry?
Because they told me I had to be a dentist.
They told you. They said, hey, pal, no other options
You're
here.
going to be the best dentist in the world, so.
We're going to make you the best dentist.
Yeah, and I was like, nope, not doing it. And so I literally just, I did the exact opposite. I've always been into computers and digital and, like working with sound and audio and hooking things up and, just building things, fixing stuff. Mm-hmm. So I've always done that. And then the engineering part kind of was interesting. So jumped into that. And then I really figured out after getting out and actually working in that industry that dentistry was where the roots were. So, coming from a dental family, I literally have been going to work with my dad since I was 10 years old.
Which is crazy. That's really cool. I actually met your dad before, a couple of years ago. Great guy. So how much of a inspiration was he for you, growing up?
Yeah.
When it came time to tell your dad, hey, I think I'm going to become a dentist. I want to follow in your footsteps.
Big time. It was like literally 10 years old. He had an office at the old Winter Park Mall.
Okay.
If you remember that. Mm-hmm. And he bought a Chuck E. Cheese that went out of business.
Okay.
And bought all their characters, and he put it up into this shopping center dental office. He had all these characters everywhere, and it was really cool, at 10 years old. And so I would go there. He would put me to work. I would sterilize instruments, or I would work in the lab, trimming, cutting models, to the point where I think I was 14 years old. I started working on patients as an assistant, as an orthodontic assistant.
Okay.
And my summer jobs were typically tracing cephalometric x-rays. He would pay me, I think it was something like $1 an x-ray or something like that, which is essentially slave labor, because anywhere else that he would go to have someone trace him, they're probably like $10 each at that time. So, but that was my gig. I did that. I had a light table in my bedroom, and I would trace x-rays on a computer, and I'd have them put them in charts and give them to him, and he loved that. And so I got a lot of experience doing that.
Now, is your brother, he's an orthodontist?
Yeah. Jason's, okay. I'm the black sheep.
Okay.
Yeah, I'm the implant dentist, so I'm the one that didn't go into full-blown ortho. But Jason's an orthodontist. He's got a practice up in St. John's, which is Jacksonville area.
Sure.
And he's got a great practice there. And I just always had a passion for implants. And literally the second I saw it and like it kind of was introduced to me, I fell in love with it. So
How long have you been doing implants for?
Oh, goodness. Almost 15 years now. I think 14 and a half years, something like that.
Okay. So let's talk about your college experience. So you said you grew up in Brevard.
Mm-hmm.
You lived in Orlando.
Mm-hmm.
You went to Full Sail,
Mm-hmm.
which is a great school. Graduated from there, and then decided, hey, I want to become a dentist. So from there, what was the next step?
So, honestly, what happened was when I was, goodness gracious, I was probably 22 years old, and I got invited to go to Colombia and just for a visit, and went down there and absolutely loved the country. At that time, the only thing I knew about it was cocaine and Pablo Escobar, right?
Yeah.
Which is interesting because Colombia doesn't have a drug problem. America does.
Mm-hmm.
So it's export only out of Colombia. So it's the complete opposite of what people think. And it ended up, I went down there. Originally, I was going to go to dental school and go back and get my prereqs for dental school. And the idea was I was going to go to Colombia for 6 months. It turned into 7 years.
Wow.
So I lived in Bogota, Colombia for 7 years.
7 years.
Went all the way through the curriculum for dental school, and it's a 6-year program.
Okay.
So went through, did all of that, and then came back. I really thought I was going to stay at one point. It's a beautiful country, and I absolutely love it, but I really miss my family, and it kind of over the years got to the point where it's like, all right, I want to go home. I need them. I need them close, and even today, like I'm a big family person, so I've got 3 kids. I'm always trying to be with them as much as I possibly can.
Yeah.
So that was the hardest part, was not having them there. But once I left, I came back here. I did a residency at University of Florida.
Okay.
And got my dental license in the United States. And then I went to Alabama and did a residency in Alabama, which mainly focused on implants and full arch restorations, dentures, basically rehabilitation. So figuring out how to help people was one of the key points in that residency. And our clinic was a drug rehab center as well. So a lot of people, you're helping them by giving them a second chance.
Sure.
So, so many people would come through there, they've just hit rock bottom, can't get a job because they got one tooth. As you figure out, you change somebody, literally, you change their face, you change their life, they go get a job, they get back on their feet, they're off of drugs, and they actually help and contribute to society, and it is the most rewarding feeling. That's really the reason I do it. Like at the end of the day, is when I can give somebody a second chance and a new set of teeth, and it literally changes their entire persona in 1 second.
Their whole aura.
Yeah.
Their whole aura changes.
It's
you're giving
awesome.
You're giving them confidence.
It's awesome.
Yeah. And you see it every day. I see it every day. And I think that that's something that people don't necessarily spend time thinking about. And it's that emotional aspect of, how is this going to change my appearance? And if this changes my appearance for the positive, what's that going to do, to me here personally? Is this going to, is this one of those things that's going to boost my confidence?
Yeah.
And you always see it. It always does. It always does. That's awesome. So that was kind of your passion for wanting to get into implants, was you wanted to use that as something that you're not just putting implants in somebody's mouth, you're literally changing their life.
Yeah, that's the key.
Yeah, that's awesome.
That's the
So
whole thing to
you
it.
graduated from the program in Alabama. What program was it?
It's called Foundry Dental Center. So at that time, it was sponsored by Lutheran Medical Center, which is the biggest postgraduate GPR in the United States.
Okay.
They have clinics all over the United States. And so basically, Dr. McCracken started this whole program with Guy Rosensteel, and they're my mentors in this. So basically, they put this thing together where they could help to offer low-cost dentistry to people that really needed the help.
That's awesome.
So it was awesome. And like first day of residency, he gave us this stack of money, which was fake money, but $5,000, and it was called Foundry Bucks.
Okay.
He's like, you can use this any way you want. And so if somebody comes in and they're, down on their luck, and, they don't have any money and they're in pain, and they don't have the money to pay for a tooth to be extracted, you can use this and you can take out a tooth. So it was $50 for an extraction. So you'd use, $50 of your Foundry Bucks if they didn't have any money or something like that to help them out.
That's a cool concept.
It was a cool concept, and it was something that I really appreciated because my grandmother was the same way. It was always like, you don't just dole out and give people things because you create this type of person that's just, give, gimme, gimme, gimme.
Mm-hmm.
It was like, it's a hand up, not a handout.
Yep.
She always said that my whole life. And so Dr. McCracken and Rosensteel were the same way. And so I was really fortunate to be able to help so many people by doing that. It was awesome. It was just great to be able to help people. And I still like to continue that on today. I unfortunately, we don't do $50 extractions here,
Mm-hmm.
but I will help people when they need it.
When I think about the first time that I met you and the interactions that you and I have had over the last 10 years, one thing that sticks out to me is who you are as a person. I feel like I know you are a very genuine person, and you really genuinely care, and you spend a lot of time not just with patients, but also you're a full-time business owner.
Yeah.
And so when you opened this practice, what year was that?
2014.
2014.
Yeah, we're
Okay.
10 years in September.
Wow, it's gone by fast.
Mm-hmm.
Yeah.
I know.
Look at us, huh?
I had brown hair.
Married now, kids. You've got a second office. You have another doctor that's working with you.
I actually got married. So I closed on the practice on Thursday, whatever that was, August 28th or something like that. Drove up to Destin, Florida, got married that weekend, which is Labor Day weekend.
Mm-hmm.
And so Monday was off. Tuesday I was at work. First day here.
Wow.
Yeah.
Just
Go,
fast.
Close practice, married, work.
Wow. So what was your vision from the start when you opened this place? So first of all, I mean, it looks like you just remodeled the office recently. It's beautiful in here.
Thanks.
What was the vision from the start? Like, did you know that you wanted to open a practice in Altamont Springs, or like, how did this all come?
No, I knew that I wanted to have my own dental practice. I knew that I wanted to have something where I didn't want to be under the umbrella or the finger of a corporation and, having somebody tell me what I can and cannot do,
Mm-hmm.
and telling me how to do it, like, cutting corners on materials, for example, and, seeing more people so that you're bumping revenues and things like that. I never wanted that. It was always about helping people and doing the best thing for them and what they needed. And so that's what I've always tried to do. That was kind of the vision. And then I also wanted to be able to have the ability to move towards a digital solution, not necessarily digital, but towards something that was using the technology that was out there. So I've always been on the forefront of that. We were testing a new product Wednesday. Today's Friday. So we were testing a new product. BioHorizons, as a matter of fact, is looking at on Wednesday, and it's not even released yet in the United States, but we were testing it and trying it, and that's always kind of been my focus. I wanted to see if there was a better way to do things, figure out what was the best for the patient, and streamline the process. So I always wanted to do that. And I also wanted to have the ability where I had my own practice and I could do what I wanted in the practice.
Mm-hmm.
It's like, I don't want somebody telling me that I can't do something because, that's not what general dentists do. You know what I mean? It's
Mm-hmm.
like, I've always wanted to do the absolute best job that I can do. And I've always gone and wanted to learn more and more and more. I've never stopped learning. I was in a CE course last week up in Charlotte, and it was awesome. It was absolutely awesome. I learned a lot. And a lot of it I'd seen, but sometimes you see something, you don't really know what you're seeing.
Mm-hmm.
You see it for a second time, and it's like a light bulb. Just something goes off, and boom. It makes it that much better. It makes the process for the patient better, and the results come out better. So I've always wanted something like that.
I look at how many different CE courses there are, not just in Florida, but around the country. And, these courses are so valuable to doctors, and it doesn't matter if it's, a product or procedure that you've been, doing for 10, 15 years. There's always new stuff coming out, and there's always the opportunity to continue to sharpen your skills. So I commend you and every doctor that, continues to go to CE courses on a regular basis because it takes you out of the practice usually for a couple days. There's a cost associated with flying and hotels and rentals of cars and everything else that goes along with it.
Huge cost.
It is. It really is. That's awesome. So, you also teach courses. So talk to us about that.
So part of my other passion is actually helping other doctors to learn.
Okay.
And implants is my main focus in what I do teach. I love helping. I personally feel like general dentists should be placing implants, period. I don't like it when I hear people say general dentists shouldn't do that. I just don't feel in my heart that that's true. Now, with proper education and having and sharpening the skill, like you said, it can be done predictably and in conjunction with a specialist if needed. So, and there's cases out there where you need a specialist to help you out. But quite frankly, there are so many people in the world that need help. I mean, you just boil it down to Florida. So many people in Florida that need help, right? That if there's not enough general dentists out there to help them with what they need, then we have a problem. And that's a constant problem that's always going on with the Board of Dentistry, with the state of Florida, with the education system, is access to care. I always hear that whenever we go to meetings, access to care. So by helping other general dentists to learn how to place implants and do it predictably, I feel like in my heart I'm doing a good service to everyone. So not only the general dentist learning how to do it, but also the patients for receiving the treatment.
Sure.
Because not everybody needs to go to a specialist. If it's a simple implant and it's something that can be done in an office predictably and you're not going to cause any harm or damage, why wouldn't you want to do that in your practice? So if I can give you a cookbook, if you will, or a method that's easy and predictable, and you can always fall back on that, and you can do simple implant procedures, that's huge. All right. All the way to the point where, like, I really, in my practice, my passion is in full arch and grafting. I absolutely adore that. I could do it every day for the rest of my life and be happy. And there are a select few dentists that will get into full arch, and I think that's fantastic, and I would love to help them along the way. So that's another thing that I like to help people do as well, is teach them, because it depends on where you want to go. You can do single implant, you can do implant bridges, you can do overdentures, you can do anything all the way up into full arch treatment, zygomatic, pterygoid implants. There's a myriad of different things out there. So it depends on what the person wants to do and how far they want to go with it.
Yeah. How long have you been teaching courses for?
So 8 years now, I believe.
And how many do you typically teach a year?
So we do, it's actually been increasing over the last few years, but I think last year we did 6.
Wow. Okay.
So, or I did.
Now, are you traveling around the country to do these?
Yeah.
Or is it in Florida? What's kind of...
In Florida, Louisiana, Atlanta. I've done Charlotte. I've done Cincinnati. So mainly I'd say probably Southeast and Florida right now is kind of where I stay. I have to limit it some because family. I've got 2 4-year-olds and a 5-year-old. So you're a twin dad, so you know how it is. It's like we're part of the twin club. So,
and you have to be on, right? Like, for people that have kids, they know this, but it's how do you manage your time effectively, and how do you stay present when you're at home with your family? Because you work all day, and then you get done, and you're still thinking about work. You're thinking about patients. You're thinking about things that you need to do. But then you get home, and you need to turn off that dentist and business owner hat, and you need to now be present as a dad and spend time with your wife, spend time with your kids. How do you balance? What's the key? How do you do it?
I don't know. I just go.
It's repetition.
I just go. I just never stop. I've never been able to stop. That's why I can't stop. I teach, but I learn.
Yeah.
I go to courses. I don't even know, 50, 60 hours of CE a year myself.
Wow. Okay.
That's
a big commitment.
I just do it. It's every single time I go to a course, I don't care if I've seen all of it. If I pick up one thing, just one thing, it's worth it. It's just one little thing, another tool in the tool bag.
So what do you have coming up this summer? Are you teaching any courses in Florida?
Yeah, I'm doing, I believe in August, we're doing a photogrammetry course.
Okay.
So basically, photogrammetry is taking impressions for full arch using digital technologies. You're using like a target system, so you can coordinate the position of implants. It's absolutely phenomenal. I will never do a conversion again, Eric, ever.
Okay.
Not going to happen. You could say, "Oh, we'll pay you $100,000 to do this one." I'll be like, "No."
Why?
Not, because the technology's better in photogrammetry, and our digital workflow is better. At this point, it's better.
When you say better, like what does that mean to somebody
more
that's
accurate.
watching this that doesn't necessarily have adopted either that technology yet, or maybe it's somebody that's not in dental that's watching this?
Sure.
How has that technology changed the game?
It's more accurate.
Okay.
It's easier for the patient, right? And you get better results. Just period. Like I just don't feel like the way that I learned how to do it, 15 years ago, when we were picking up plastic dentures and doing that, versus us being able to 3D print, something that's a temporary for a patient. My method and my thought process in this is that I want to go to a temporary prosthesis for the patient first. There's a lot of places out there like we go straight to final. What if there's something that goes wrong? Like what if an implant fails? Which implants can fail, and they do fail. This is one of the things when I'm teaching one of my courses as well, is I will tell dentists, if you've never had an implant fail, you're either not placing enough or you're not following up on your patients. And it's like implants can fail. So, I tell my patients for every 100 that I place, 2 of them are going down. It's going to happen. So I want to figure that out before we actually have a patient commit to something that's going to be long-term. I want them to have a long-term solution. So if I can 3D print something for them and make it a long-term solution, or a temporary solution, get them to something that's going to last them hopefully for 25 plus years, I think that's a great benefit to the patient.
Sure.
So as far as your question goes for digital technology, why is it better? I feel like we're getting a better result and a better long-term result for the patient in general.
That's great. Yeah, the rise in dental technology is something that we talk about a lot on this show, just because things have progressed so much over the last just 10 years with restorative scanners. That's a big one.
3D printing.
3D printing is another
Milling.
one that's huge. Milling, yeah, a lot of stuff that we used to outsource, and now you're able to keep it in-house. And what that does for a workflow standpoint is what?
It reduces costs. It's quicker. It's more accurate. Get better results in the end. So, and on top of which, for any dentists that are listening to this, it's fun. It's just more fun. It's like, I remember when we were taking impressions with PVS or polyether or whatever, and just, you take an impression.
Goopy mess.
Well, I don't care if you're like the best impression taker in the world, and you take it out and look at it, and there's one little error. It's like, I got to do that again.
Yep. Speed's the name of the game. Speed and efficiency.
I'd say accuracy and efficiency, and then speed would be something that catches up.
Yep.
You know what I mean? It's like I talk to a lot of new dentists and residents, and I tell them, like, don't worry about speed. Don't worry about that right now. And this is one of the other things, one of the other, I guess, beefs, if you will. If you go, new grad coming out and they go straight into a corporate setting, speed is the name of the game. And so accuracy will fall back and efficiency will fall back. Right? It's just more. That's I hate to generalize that, but that's kind of where it goes. And for me, I try to do the best job that I can. So if it takes me a little bit longer, that's okay. I want the end result to be the key.
Sure.
I want it to be perfect.
And that's what the patient wants, So you're aligning with the values and goals set forth.
Yeah.
So what else? What other courses do you have coming up that you're teaching?
So we've got another photogrammetry in September.
Okay.
Let me see. February next year, I've got AIE and digital workflow that will also have photogrammetry in it. And then April of next year as well in Atlanta,
Okay.
February is in New Orleans. April is in Atlanta.
So what other courses do you have coming up that you're going to be teaching?
So I'm starting an implant continuum.
Oh, okay.
Melbourne, Florida area. All right. So doctors that are either new to implants or want to start placing implants, or maybe some that are already placing implants but may not have that confidence and kind of want to go to the next level.
Yeah.
So we're going to do something like that. It's going to be a continuum, so 3 or 4 sessions. I'll do a didactic portion and then also a surgical. So doctors can bring their own patients, they can bring their assistants, and really hone in how to adapt it and put it into your practice. I think that'll be the number one main goal of the course. And then I'm going to expand on top of that. You know, like I said, I think you said earlier, is, you know, bone grafting.
Mm-hmm.
You know, one thing is bone grafting and just throwing a little bit of stuff into a socket and thinking that it's going to be okay. And another thing is actually bone grafting and building ridges, coming back and knowing that you have a slam dunk. Like having that confidence that your graft is going to hold any implant you put in. That's a really wonderful feeling. So that's one of the other things that I kind of want to weave in there as well. So
That's
yeah.
Man, that's great. I think that anytime you're able to to do a course, a local course, especially that's not like in a major city where people are going to have to drive and travel to, is a huge added benefit, because I know there's probably a million doctors between Daytona and Vero that would probably jump at an opportunity not to have to travel to Miami or Tampa. So that's awesome.
Maybe not a million, but I know there's a
Close.
few.
Yeah.
It's close.
So if I'm a doctor and I want to learn how to start placing implants and I come to your course, like what could I expect? What does that look like?
So how do you mean, like what the days would look like?
Yeah.
Okay. So I really want to start
the
out.
curriculum.
So like first 2 days, I want to start out with curriculum didactics.
Okay.
I want to give you the knowledge base that you can say, okay, I'm good. I want to go place an implant, right? Then the next day, the third day, if you will, I want you to actually do it. And I'll be right there. We'll have help and other people there to help look over your shoulder and make sure that you are comfortable. Mm-hmm. You know how to lay the flap. You know how to position it right, get it there, do your osteotomy, take that implant home. You know, that's the main thing. Abundant bone first, you know, and then from there it will build.
Okay.
From there it'll go. So down to taking a tooth out and grafting that site, right?
Yeah.
And different methods, membranes, different types of membranes, different suturing skills, you know. I'll tell you, I think I told you earlier, that course I was in Charlotte,
Mm-hmm.
you know, the thing I learned that was the coolest part was a new suture technique.
And that's something that you hadn't seen or experienced before, and that was
No,
one of your main takeaways was that new technique.
So it's Vincent Ronco is the guy that came up with it, and he's actually in Paris. I was going to go and fly to Paris to take his course in October, but I have my anniversary, so my wife was not into that. So we are not going to Paris this year. But anyways, the guy that taught the course, Dr. Bolchi, he put that up on the screen. I saw it. I've been reading this book and trying to figure this thing out. And like I said, that one little pearl switched it on.
Wow.
Yeah.
That's cool.
One little thing. And literally, like, a lot of times when I meet new dentists that, you know, want to learn how to place implants, you can say something like, you know, how's your suturing? They're like, well, I didn't get to suture a lot in dental school. I will teach you how to suture as good as any periodontist or oral surgeon out there.
That's great.
I love it.
That's awesome. So we're talking about implant placement. We're talking about using biologics for
resorbable and non-resorbable.
Okay.
All right. Biologics like PRF, you know, suturing technique, flap management, soft tissue management, hard tissue management, implant placement, positioning. You know, where are you going to put it, right? And I know that this for a fact, because there's so many more general dentists that want to learn how to place implants, is they may be receiving implants back from a specialist or somebody else that put the implant where the bone was.
Okay. Yeah.
Right?
Mm-hmm.
That's a commonality in all the courses that I teach. And, well, you know, if the case is not set up properly from the get-go, what is the specialist going to do? Right?
Mm-hmm.
They're going to put it where the bone is. That's the only way. So if the general dentist or the person trying to learn how to do this wants to put it in a different position, they'll learn how to do that. Meaning, build the bone to put the implant where you need it so your restoration comes out great. That's key. Really, the whole thing with implant placement is thinking about where the final restoration is going to go first, and then figuring out what you need to do to get the implant where it needs to be.
Okay. Yeah. Makes sense. There's 2 ways to place implants, right? Guided surgery, freehand surgery. Do you teach both?
I do.
Okay.
I will tell you that I like to start with freehand
Why?
because guides don't always work. As wonderful as everybody makes it out to seem, if a guide goes wrong or something goes wrong in a guided surgery, I want them to have the skill to fall back on. I can do this, and we can still complete the surgery freehand.
Okay.
You got to be able to do that first.
You do.
If you get yourself in a pickle with a guide, like, I mean, say you put your guide in and it breaks, you got them flapped open and, patient's bleeding, you're going to say, oh, sorry, I'm going to suture you up and come back later.
Yeah, that's not going to work.
Well, I can tell you this, Eric, it's not a practice builder. So you got to be able to fall back on solid ground, solid surgical skill first. And from there, you go to guided. Like, for instance, you asked me about guided. I do almost every single one of my single implants, I do guided.
Oh, okay.
Right? And I flap every single case.
Okay.
And people think that if I do guided, I don't have to lay a flap. So technically, that is true. However, do you trust that piece of plastic that much that no matter what, that implant's going to be placed properly? You can't see where it is with your own eyes, and I want to be able to see that myself.
Yeah.
So that's the way that I teach it. Almost every case that I've done flapless, something's gone wrong. Like I put the implant in and it was a little bit too shallow. Once I took the X-ray. So what do? I flap it open. So you're just adding more time. Flap it open, put the implant in the right place, reposition it, whatever that means, whatever it needs to be, and then go from there. But if you start out with those solid fundamentals, you're going to be an absolute success in this.
Yeah,
You'll always be able to fall back on your surgical skill.
Well, I'm glad that you do that, and I know that you're a great presenter, educator. So I hope that you get a lot of people that come down to that course and learn from you, because you're fantastic at what you do.
The more people that I can teach how to do this means the more people we can help.
Well, tell me more about your philosophy when it comes to owning a practice. Like how do you manage your time from being a dentist, but also coaching and developing and leading a team of assistants and hygienists and your front office people? I mean, it's a lot. Like that in itself is a full-time job. What are some things that you work on with your team, maybe currently, or things that you've done in the past that have made a big difference?
Well, with the team, I think one of the fun things that we do is, and especially when I have a new hire or something like that, I really try to focus on somebody that's going to fit into the family, because that's really what they are. It's like, I mean, I spend more time with my team than I do with my own family.
Yeah.
Yeah,
it's true.
And so, they are family, really. So one of the cool things we do team builders. Every quarter we go do something.
Oh, okay.
Like I think one of the most memorable and fun ones was we went to Alligator Land, and we zip lined over alligator pits.
Gatorland, you mean?
Or Gatorland.
Yeah.
That was awesome. I liked that. We've been to Pop Stroke and done the putt-putt thing, and do fun stuff.
Yeah, people like that. It's always nice to get people out of the office. Get to know them more on a personal level, building camaraderie, things like that. So that's great. That's great. Now, from a skill set in the office, what do you do to keep your team dialed in and as passionate and in the moment as you are?
Coach them. I try.
Okay.
Try the best that I can. I try to teach them. I similar to what we do in the courses. And when I have somebody on the other side, an assistant that's learning how to do something, I really want them watching me. I take a ton of photos. I've got a whole video set up in the back. So we do a lot of video as well. I try to do as much as I possibly can, especially on surgical. And then just coach them, teach them, tell them how to do things. Like, also tell them why. You know, like Simon Sinek, the whole thing on why.
Yeah.
It's like, why do you do something? It's like, there's a reason that we do everything, right? And there's a reason that this will work this way because it's done in this manner, right? And so I try to encourage people to follow those steps so that it's repetitive, but also so that you get the same outcome every time, right? You try to deviate from certain things, and you're not always going to get the same outcome.
Yep, that's true.
So those are the big things that I try to do.
So all of the things that you are involved in, from a technology standpoint, the things that you're using in your practice, you being an educator, you mentoring, coaching, and developing your teammates, all of these things play into the patient experience, right? And we talk about that a lot on the show. Is what in your mind do you want that patient experience to look like from the moment somebody walks through this door? Because when somebody walks through this door, they see, man, this is a beautiful lobby, and you know, great artwork, and it's clean, it's very professional. My first impression, if I was coming here for the first time, is, wow, looks like a really nice office, right? So that's your first impression is formed typically within the first 15, 20 seconds,
Sure.
maybe even less. So once a patient gets brought back and you're talking to patients, consults, etc., what are some things that you want to make sure that you do or you say or you send them home with that is going to really make them feel valued as a patient, putting their mind to ease when it comes to realizing that potentially they might need a service or a treatment, and they want to go home and talk to their spouse about it, or just time to think about it. What is your philosophy on patient experience, Doc?
I think first and foremost, I want them to feel welcome, and I want them to feel like they're going to be taken care of.
Okay.
And really, honestly, become part of this family. It's really what it is. Like, I mean, so many of our patients are just like family members. You know, it's just like we know them. It's first name basis, and you know, we're here to take care of you. You know, we're gonna fix a problem if there is one, and if there's no problems, we're gonna maintain health. You know, those are like the key things, and I want everyone on my team to relay that as well. So again, it goes back into coaching them, to helping our team members express that.
Yeah.
You know, from the start. I mean, honestly, it starts at the phone call.
It does.
Like that's the main.
Or the website even.
Or the website.
Yeah.
Yeah. You know, like you go to the website, look at it, and watch videos, watch testimonials, look at the reviews, see all of that. Once you pick up the phone, it's like, okay.
If I wanted to check out your website, what is your website?
DreamDentalServices.com.
DreamDentalServices.com. Okay. And you've got videos on there, and you've got...
There's videos, there's testimonials, there's a area where you can go look at reviews and stuff and see what other patients think. There's information. You know, there's everything you could really imagine. I mean, it doesn't get into the nitty gritty on how we do certain procedures, but
Yeah.
if you need a procedure like an implant, it'll show you kind of what it is, kind of start to finish.
Yeah. So people can kind of see that on their own terms,
Yeah.
and it's not like they're watching it on a screen while they're sitting in the chair in your office. It's more of a comfortable, casual way to
You can look at it on your phone.
Yeah.
That's like 90% of people use their phones these days.
Yeah. Incredible. Okay. So that's from a technology standpoint, speed, right?
Yep.
Boom. It's right there at the disposal of your fingers. Now, when you treatment plan somebody and they want to go home and they want to talk to their spouse, what are you sending them home with? And the reason why I ask is this. So I spent a lot of time thinking about what percentage, and this is something that, you can Google. Think about what percentage of people are visual learners compared to audio learners. And if you look at the percentage, roughly 75%, I think, of people are visual learners. And yet, when we're in a dental office, I think we do a good job of using those visuals to talk to patients, showing them, X-ray and being able to explain what's going on, but also using, I think you guys have like iTero, right? Your scanner, and using the 3D model and the images on that in order to talk to the patient. All of those things are fantastic. But the question is that when I get home and I want to talk to my wife, what am I going to be able to show her or tell her from our conversation in the office, 4 or 5 hours prior to that?
Sure. So they'll be sent home with a treatment plan.
Okay.
Usually has a rundown of what procedures need to be done. My preference is that it's a one sheet. So it's one page that says this is what will be included in the treatment, start to finish. This is the cost.
Gotcha. Okay.
Right? And then from there, typically they'll have a folder. It'll have information about the office. It'll have, and I wish I could specify for each individual patient what in our magazines, for example, what we have, but there's basically a magazine that has a rundown of all the different dental implant procedures. And most of the time what we'll do is we'll earmark a page or something like that for the patient so they know kind of this is what doctor was talking about, if it's a graft or something like that. And a lot of visuals in there, a lot of photos. There's before afters as well.
Okay.
So they can see that kind of life-changing event, if you will.
Gotcha. That's awesome. What do you like to do for fun when you're not working and you're not being a dad? What are
Play
some
golf.
things? You're a golfer?
Oh, yeah.
Okay. Big golfer. What's your favorite course in this area?
To play?
Yeah. I'll put him on the spot.
You really did.
Stony Brook West?
No.
No.
Honestly, my Interlaken is my favorite course.
Okay. That's your go-to?
Yeah.
What
That
else
is my
be-
favorite course here.
What else besides golf? What else do you like to do?
Scuba diving.
Oh, yeah?
Yeah, I haven't been diving in forever because kids.
Yeah.
There's not enough time to do that. And it's funny, in the last 4 years, I've started reefing. So I have saltwater aquariums at the house. I think that kind of plays into the scuba diving part because I used to love going to dive on reefs.
Yeah.
And now I've basically put a reef in my living room.
Which
So-
is, yeah, that's a lot of upkeep too. We talked
Yeah.
about that a couple weeks ago, and I remember
I
you
have
were
a-
telling me you were going to a show and you were looking for some specific, I think it was either coral. It's
Yeah.
coral, right?
I have 350 gallons of water in my living room.
Wow.
Yeah,
That's a big tank.
jam-packed with coral.
No kidding.
And
What else do you have
fish.
in there? What kind of fish?
I've got a couple tangs. I've got some wrasses, Bengai cardinals. Let's see, what else do I have? Clownfish.
So
Got
how
some
much time?
starfish.
How much time do you spend a week on upkeep?
I get up at 4:30 every day.
Wow.
Every day I do about an hour. Just
Okay.
Water testing. And
Every day.
Every day.
But you love it.
I love it.
That's cool.
I love it. It's like
That's a unique hobby. You know what I mean?
it's my garden.
Yeah, it really is.
It's like the stuff that I grow in there is beautiful.
So I'm gonna end it with one last question. I got one question for you. So you've been practicing in this office for
10 years.
10 years. You have another location as well.
Mhm.
And
We
where is
just
that
opened
at?
that up. That's Maitland.
Okay, so you got a
So
location
it's
in
about,
Maryland.
I don't know, 15 minutes from here. 10 minutes.
Okay. When it's all said and done, what do you want your legacy to be?
You had to ask that one, didn't
Mhm.
you? You know what? When it's all said and done, I want to finish everything being known as an educator and helping other people to learn how to help people. And first and foremost, I should have said this first. I want to be a great dad.
That's awesome. I do too. It's hard.
It is hard.
Yeah. There's no training courses for how to be a good father.
No,
right?
there's not.
Yeah.
So I just hope that they look back and say he was awesome. He was a great dad. And I hope that a lot of the people that I help to teach, learn how to place implants can help other people and say, you know what? I'm glad I went and learned from him.
Yeah.
They're not going to learn everything from me by any means, but if I can get them started and it sets them on the path and, they get into it and they start helping more people, then I've been successful.
I love that. I'm so glad that we had a chance to sit down. Thank you so much for being on the EG Dominates podcast. I wish you nothing but success. You're such a great guy.
Thanks, man.
You really
Appreciate it. It's
You really
fun.
are. Thank you. All right. That wraps up episode number 4, and we will see you on the flip.
I was down, but now I'm